A lot of people are interested in these healthcare hackathons. We have, half-day ones. We have, usually they occur over a weekend. And every year we have a big annual grand hack on MIT's campus. But we have these around the world. And some of the winners of those events come back to MIT for our annual event. It's a little hard to describe because it's managed chaos. But it starts with problem pitching, where everyone gets a chance to pitch a problem that they're passionate about or they've personally experienced or have, frustratingly witnessed their loved ones go through. And from that, they self-assemble into teams, doctors, engineers, entrepreneurs, MBAs, students, folks out in the professional realm. We focus on themes for each event. Sometimes we have multiple themes, but home health care as the world transitions to trying to treat people out of the hospital and in their homes. Aging in place, hacking pediatrics we've done at children's hospitals around the world, hacking oncology for new oncology treatments and biotech, and the genomics revolution for clinical genomics. So we have multiple themes, but teams self-assemble, and through the weekend they go through a process of figuring out the technology solution, figuring out the journey of the users, and figuring out new business models that are compatible with the future of healthcare. So for a few hours, we all get to live in the future, and the teams present their final pitches in front of professional judges and venture capital investors. And it's just the start. These events are the catalyst, but we've had dozens of teams go on and continue to work on their solutions and eventually raise professional venture capital and bring their solutions to the market. The class is a semester. These healthcare hackathons are usually over a weekend, and especially jaded healthcare professionals wonder, what does really start? Can you really unleash something in just a few hours? And the magic of these events is that they bring the cognitive diversity of so many users and administrators and healthcare professionals, and the voice of the patient, most importantly, to have a new perspective and challenge the status quo and the way healthcare is delivered by the big healthcare incumbent organizations, who, I point out, are failing so many patients in what they're doing. They have, poor business models. They're not adapting to all of these changes quickly in healthcare. And so we convene these folks, including representatives from FDA and regulatory and insurance companies and all of these different stakeholders. We bring them together, and part of the magic is we lower those expectations so they can take risks at this event or in class. Healthcare is so risk averse because they have to be responsible. The old adage of move fast and break things in Silicon Valley just can't work in healthcare. But at these events and in our class, we remove those barriers to thinking up crazy ideas and iterating on those that would have a viable business model. And we bring mentors and experts and investors to really advise them along the path. And in a compressed time, we're always surprised at what comes out on the other end. And it's impossible to predict because it's so much a factor of the users and the mentors and the magic of bringing diverse teams together. But it happens over and over again. And we bring corporate sponsors, ILP sponsors to these events around the world, and they get to witness this, and they get to help mentor some of these and start to use or pilot some of these systems. to prove out the efficacy and the safety of them.